Hello and welcome to your informative health program on TV, Health Business. I'm your host, Oluwatoyin Kolawole. The program this morning would not be different because we have lots of informative segments for your delight. And on the program this morning, our major focus is on forensic medicine and criminal justice system in Nigeria. But first, let's bring you happenings in the health sector. The Lagos State University Teaching Hospital partners Apollo Hospital in India to set up a kidney transplant center in Lagos.
The Pharmaceutical Society of Nigeria (PSN) Council has hailed the constitutional reforms being pursued by the ruling All Progressives Congress (APC). However, the council rejected a proposal by the reform panel led by Governor Nasir El-Rufai of Kaduna State to place medicine and drug-related matters on the concurrent list, saying such recommendation portends great danger for the nation. The PSN stated this in its communique issued at the end of its National Executive Council meeting signed by the President, Ahmed Yakasai, and the Society's National Secretary, Emeka Duru. Succor seems to have come the way of people suffering from kidney failure as the Lagos State University Teaching Hospital, LASUTH Ikeja, partners with an Indian-based Apollo Hospital to set up a kidney transplant center in LASUTH at the heart of Lagos, Ikeja. This gesture was announced by LASUTH Chief Medical Director, Professor Adewale Uke, while speaking to health journalists in Lagos.
The Apollo team will support in preparing the team in LASUTH for running. We work together with our team to ensure that we have an effective renal transplant unit. All follow-up patients and new patients will be guided at this center in LASUTH.
Oke noted that the aim of the collaboration is to reduce medical tourism in the state and the country in line with the policy of the Lagos State government.
I mentioned earlier on the program that this morning we'll be looking at forensic medicine and the criminal justice system in Nigeria. To discuss this issue on the program this morning is a professor of forensic pathology, Professor Oladapo John Obafunwa of the Lagos State University Teaching Hospital and the Lagos State University College of Medicine. You're welcome on the program.
Thank you for having me on.
So let's start off this way. What is forensic medicine and how can it be used for national security?
Forensic medicine is part of the subspecialty of the forensic sciences. Forensic medicine deals with the study of the human body and how you relate this to medical legal issues. It encompasses clinical forensic medicine, where you deal with things like drugs, alcohol, the interaction of this with the human. It deals with things like attempted suicide, euthanasia, in vitro fertilization, child abuse. All these are part of what we refer to as clinical forensic medicine. That's apart from medical law and ethical issues. In forensic pathology, we deal with the investigation of the dead and see how we can explain who died, how the person died, when the person died, the circumstances, who did it. But like I mentioned earlier on, it's a subspecialty of the forensic sciences. You still need to marry this with the findings in other areas to be able to present a complete picture to the courtroom. You might have somebody who has died. Apart from the forensic pathology aspect of it, you still have to deal with the investigation in terms of the history on the part of the police, fingerprinting, ballistics, document examination, forensic entomology, which involves the study of insects, toxicology, checking for drugs and alcohol. It could be by way of individuals who go to rob a bank or whatever you, and where you have the CCTV camera, which is another component of digital forensics. You might be able to help to reconstruct the face. By the way, I forgot to mention the fact that where you are dealing with bomb victims, the nature of the injuries that you have on the body might help to tell you whether this was actually the person that carried the bomb. You look at the pattern of destruction of the body, you look at the injuries on other victims, you might be able to come to conclusion as to the proximity to the scene. So it's a whole gamut of things that you have to deal with in forensics.
Having listened to all this that you've told us now, how can we deploy this into our security life in Nigeria? And are there some policy or budgetary factors to consider?
Well, to start with, you need to have in place the appropriate legislation. If you don't have the appropriate legislation, you might not be able to take advantage of so many things. Pick for example, when we had the Dana crash, we were able to investigate the Dana crash based on the fact that we had the Lagos State Coroner Systems Law of 2007 that we used as a backup for it. With appropriate legislation, you should be able to harmonize data that you might have with the National Identification System, the BVN, the data held by the various telecommunication companies, MTN, Glo, and all the rest. All these things, you need the legislation to back it up. Meaning that government must be focused, and government must appreciate the importance of all these things and be ready to invest. You don't want a situation where somebody comes up and says to you, oh, we have this crime lab, we have that. You go in there, you don't find anything. Maybe certain things are not worth talking about, but government needs to engage services of the right people.
What are the barriers to effective implementation to forensic medicine policy in Nigeria?
Yeah, the barriers will be one, government interest in tackling the issue. And I'm not referring to just a jamboree of fanfare. Government must back it up, and if it means changing the law or modifying the law to allow us to use this evidence, government must be willing to do that. Government must change its attitude towards getting people trained. And when I say getting people trained, I'm not talking about just bringing in one or two people from abroad to come and do some crash program and give people certificates of attendance. No. If you have to send people abroad to be trained in proper institutions, so be it. I recall when I was working in the Caribbean, several Caribbean, and these are very small countries, they send people out to the US, they send people out to the UK to train hands-on equipment, and by the time they were coming back, the crime laboratories were already in place. The equipment were there, and they were quite eager to help in building up these facilities. I know there is a fear that if you send people abroad, some of them will not come back. I don't think we should worry about that, because if you send 10 out, maybe 2 or 3 will come back, and those ones are enough to set the ball rolling. By the time those that might have gone out and stayed out there realize that they are wasting their time, they can never rise to the top, they'll come back and contribute whatever they need to contribute. In addition, I think it's important that members of the bar and the bench must have some element of training in the forensics, so that they can appreciate forensic evidence when it's being given in court. They can appreciate who is truly an expert witness.
All right, to my very last question now. What are the benefits of effectively implementing forensic medicine policy to Nigeria as a nation?
And effectively implemented will go a long way to change the face of our criminal justice system. I'm a witness to the fact that prior to the Lagos coroner systems law, anybody could just walk into court and give evidence. Anybody, any physician could do an autopsy. That was what the old coroner's law said, a medical practitioner. But under the Lagos State Coroner Systems Law, you have to be in the list an anatomical pathologist, not necessarily a forensic pathologist, but it's only an anatomic pathologist that can do an autopsy. The quality of evidence has improved. We have been able to, guided by that coroner systems law, we've been able to do things which hitherto we couldn't do. Like I gave the example of the Dana crash. Nigeria was used to mass burial, but because of what we were able to do in this department at that time, we were able to identify 149 of the 152 victims. The same thing with the synagogue building collapse. 116, we were able to identify 111. And when you compare these figures with international standards, you know that we are a long way there. Of course, we still had to depend on some of the samples being analyzed for us abroad at that stage. And I'm talking about toxicology, which is a very, very essential part of forensic pathology. We do not have that in the country at this point in time. I don't want to comment about the so-called toxicology report being brandished by the police in certain situations. I know better, but I'll just leave that for now.
Wow, it has been so nice having you on Health Business this morning, and I'm sure our viewers must have learned one or two information concerning forensic medicine and how it relates to security. Thank you so very much, sir.
Thank you.
Thank you.
Hello viewers, thank you for joining us today on another topic on what regenerative medicine can do for you. For those that are watching for the first time, regenerative medicine is a new field of medicine that addresses how your own body can naturally heal you in an accelerated way and restore the abnormal functions to normal functioning status of your cells and tissues. And this comprises platelet-rich plasma and adult stem cell therapy. Platelet-rich plasma is when you use your own blood to try to repair or accelerate the healing in your body, and adult stem cell therapy is when you use somebody's fat, bone marrow, or umbilical cord to be the source of the stimulation of proliferation and regeneration. Today, I would like us to discuss some conditions like neurological disorders that can benefit from regenerative medicine. You see, we doctors were taught in medical school that central nervous system does not really regenerate, but there's hope with peripheral nervous system. By the way, what I mean by central nervous system is when you talk about the brain and the spinal cord. So if somebody has stroke or traumatic brain injury, or they have multiple sclerosis, which is a combination of autoimmune disorder in the brain, or they have cerebral palsy, all these conditions can now benefit from regenerative medicine. For example, cerebral palsy is a motor function disorder. It's not a contagious condition as some people think or have been saying, but it is important to understand that all these conditions, when they are being treated at early stage to the point of the diagnosis, the chances of full recovery is better and is faster, and patients do better. If somebody has a stroke, for example, and in the acute state, within a short period of time, if they have access to adult stem cell therapy, that can help stop the death of the brain cells. Likewise, somebody who also has maybe even a spinal cord injury, they can also benefit. Spinal cord injury, by the way, could be complete or incomplete. The incomplete respond better than the complete spinal cord injury, but studies have shown that both of them do respond, to regenerative medicine. The only thing I just want to make clear is that when we talk of neurological disorders, multiple sessions of adult stem cell therapy will be needed to achieve a goal, and this can be done every three months. Studies have also shown that adipose-derived stem cells, that is, stem cells derived from the fat, they differentiate better into neurons than the stem cell derived from bone marrow. And quantity-wise, fat is also a better source for stem cells. So if somebody has any of neurological disorder that I've mentioned about, that is not a death sentence. With help of regenerative medicine, there's now hope for people. I also want to make sure that we all understand that if anybody is watching this, or somebody has neurological disorders and they're trying to try adult stem cell therapy, it's not a one-session treatment. It's very important to make that clear. And the recovery or the regeneration signs are always going to be slow. Remember, we believed that central nervous system does not regenerate. Do not expect this to be repaired overnight. So please, I hope I've been able to educate you on how regenerative medicine can help repair or restore some of the neurological disorders. I am Dr. David Ikudaisi, US board certified internist, regenerative medicine specialist, and I'm looking forward to see you on another topic next week. Thank you.
On the pharmacy segment this morning, Health Business went to town to sample people's opinion on why drug abuse is rampant among young people.
A lot of people is under depression and stress because of that, so everybody want to take something to ease their pain.
I think it's peer pressure. When they see their peers doing it and they just want to do it, or sometimes because they want to impress others and big girl, big boy kind of thing.
If it's not carelessness and indiscipline, how can you take something that will destroy you?
Some people abuse drugs to erase depression. Some also abuse drugs to be high.
Young people abuse drugs because they have easy access to it.
If you have something doing, going to your work, coming back, I don't think you have time to use drugs.
Most of the time, young people, they would like to be high.
Some like the feeling of being high. Okay. You understand? Like maybe take overdose of codeine, overdose of tramadol.
I think the main problem is peer pressure.
They feel they can be like Van Damme when they take drugs.
If they are not okay or satisfied with their drinks, most of them, they will go on drug.
We elders should continue advise them not to waste their life.
If parents could enlighten children about the problems, the horrors that comes with using drugs, then it will deter them from using it.
Bring up the kids the way you want them to grow up. It starts from the home.
It's now time for Dr. Abayomi Ajayi to educate us on issues affecting fertility. Stay tuned.
You're welcome to Understanding Infertility. My name is Dr. Abayomi Ajayi, and today we're going to be discussing female infertility. Other things have crept into the surgical armamentarium in female infertility, and that is endoscopy. When we talk about endoscopy just means looking inside the body, human body, without really going there. And it's based on the concept of like using a telescope. You use a telescope without shortening the distance between 2 points. So you can also do something like that. And there are two main kind of telescopes that, if you allow me to say that can be used in gynecology. One is called hysteroscopy, which goes through the vagina into the cervix and then can look inside of the uterus. And the good thing again is that you not only look, you can even do surgeries there. You can remove polyps, you can remove fibroids, and you can break down scars. But the only thing you can do are the things that are inside the cavity of the uterus. You cannot do anything that is outside the uterus. When we talk about IVF, a few programs away, I also discussed the differences between IUI and IVF. But IVF, intrauterine insemination, and IVF is in vitro fertilization. The difference between these two is in the complexity of bringing the sperm and the egg together. In IUI, the egg and the sperm meet in the body. In IVF, they meet outside. That's why it's called in vitro fertilization. It means fertilization outside the body. Anyway, so there's some things that have also sprung up from female infertility. When, we've been talking about age and infertility, that women tend to be less fertile as they grow older. And that is not unusual because women, unlike men, come with all the eggs that they're going to use in a lifetime. And this keeps depleting with time. So when women reach about 40, success rate is really very low, less than 10%. And therefore, sometimes it comes to the fact that we might need to use egg donation for them. whereby a younger person might need to donate eggs for an older person. This is usually for women over 45, 42, 45. And that's why, they're talking about all the superstars getting pregnant at 50, and most of them, 99% of them, will use egg donors. So sometimes that's the question we face when we're trying to treat women of older age group and they're insisting on using their eggs. It gives abysmal results. So most of the time, it's important for you to be ready to have a discussion about that. Nobody will force anybody to use donor eggs, but it's something that is worth discussing. Another thing that I just want to mention before we conclude this program is surrogacy. This is a situation where another woman carries a pregnancy for a couple. And of course, you can ask me that what are the drawbacks of that? Of course, we remember the popular baby M, Melissa Stern, who was born in 1986. She's 30 years old now, who was the first baby that brought to fore the custody case that was aired in the US, of course. And recently, the baby that was born in Thailand called baby Gami, which was born in 2013. This was the case where the Australian couple went to Thailand in order to go and do surrogacy, and then 2 babies came. One was normal, one was abnormal, and they decided to leave the one that was abnormal. Of course, we know it ended rightly because the Australian government has given baby Gami Australian citizenship now. So it's on that note we are going to end this discussion on female infertility. You will discover that many of the topics are interlinked, so we are going to still continue to visit some of these things. I'll leave you with this. Always remember, together we can conquer infertility. My name is still Dr. Abayomi Ajayi. Catch you.
This is where we draw the curtains on health business this morning. For advert and sponsorship, please call the number showing on your screen. My name is Oluwatoyin Kolawole, and remember, living healthy is a serious business. Bye for now. Thank you.